And we do have some points to show you in terms of maybe when you should go see a doctor in regards to knee pain, because you may be like me, that you're just like, oh, it's just a little bit of pain and I'm just gonna endure it. You get a lot of that, right, doctor?
Sure, all the time.
But sometimes it gets to the point that I've got to go see the doctor. So significant swelling. What is significant to you, doctor?
Well, I mean, any kind of swelling inside the knee that kind of makes your knee blow up like a balloon, that's a big deal.
Okay, redness?
Yeah, redness can be a sign of infection sometimes. You don't typically see redness with a traumatic injury, but if you have signs of a significant infection, good time to see a doctor.
All right, tenderness and warmth around joints. So you'd actually feel that warmth?
Yeah, I mean, that usually comes with the swelling at the same time. So it's basically just a marker of inflammation in your body.
Okay, obviously significant pain, which you touched upon. A popping noise.
I think the way that you should think about that is almost like a one-time thing. So let's say you're running and you turn and you feel a pop, or sometimes you'll hear the pop. That's usually significant of a ligamentous injury, something that's bad.
All right, and we're gonna touch upon ACL tears and meniscus tears a little bit later in the show, which are very common. You hear it at so many ages. We just talked about it for a few seconds, so we're gonna dive into that in just a few moments. But are there any other common knee problems that you see that are not that serious, but they need to be tended to?
Yeah, that's another good question. One of the things I started talking about earlier is there's a different kind of runner's knee called IT band syndrome. So that's basically where it's a different tendon that's running down the side of your leg, and it's almost like a friction syndrome where the muscle basically does this and this and this as you're running, so it's kind of a runner's knee. And you get inflammation there. It doesn't need surgery. Same thing. It's a lot of stretching, a lot of anti-inflammatories and ice, and that